Great. Well, welcome. I'm very, very excited to introduce you to this group of really brilliant minds. My name is Zain Khalpey. I'm a cardiac surgeon and I'm working in Arizona, and I also am the Chief Medical AI Officer here in Arizona at a hospital network of 6 hospitals. And I've got a group of guys who are far more intelligent than I am, but also very exciting to tell you their story about why it's important to intersect with the world of data science and surgery. And intersecting all of this is our hosts, and our host is the AI Surgery Journal. And I'm just about to show you a couple of slides, and then I'm going to introduce you to all of our key players today. And then we're going to ask questions for bringing us to the next level. And then we're going to ask you, the audience, about what you want to ask us. And we've got a couple of people in the audience who are really cool as well, who are from industry, from actually Intuitive, with the Da Vinci robots. There's a couple of other people from other companies there, and also a couple of other surgeons. And so really excited to hear from them and talk to you. So I'm going to share my screen and plod along. Excuse me. Okay, can you guys see my screen? Perfect. Well, the Artificial Intelligence Surgery Journal is a very cool journal. It basically is being indexed at Scopus, and it's really the only surgical journal that focuses on the interface of the art of surgery and the art of science, and mainly data science. And they've been a very productive group with impact factor coming up to about 3.4, and with a really international crew. And the captain of the ship is Andrew. Andrew Gums is, Dr. Andrew Gums is a triple Yale guy, and he's now residing in France, married to an Italian, and is a brilliant friend. And he and I had a great podcast with Vincent DeGrasso, who run this podcast. And I was fortunate enough to be on that podcast with them, and we had a real laugh. But it actually just delves into the lives of the people who are behind what we do. And it also hosts webinars like this. And so Andrew's a really, really provocative thinker. He is in Europe right now, and I think what he's trying to do is really build the bridge between with a common language to data science and to physicians, especially surgeons, because what we do is extremely highly complex, but at the same time, we're a small niche of people, and you'll get to see all of the robotic surgeons today that we're going to introduce you to, who actually are exciting about what they do, and now how can we really put an AI pipe into our operating room and change the world. So we're going to show you some of that today. And they have really cool articles in their journal. And all of the speakers today are actually part of our guest edition for AI in cardiac surgery. And we are going to kick this off by not only just telling you about me, but which you've already heard, but what I really do behind the scenes is I like to break things, but also build them and put them together again. So we've broken down the old archaic kind of DOS-like system, which we used to have in our hospital network, and we've kind of refreshed it with new pipes. And healthcare is really a good space to be in, but a difficult space to be in when you're talking about responsible artificial intelligence. And we're going to talk, and all of the speakers are going to talk about responsibility and good clinical governance. That goes without saying, and I think that's why they're here, to be responsible. So I am going to kick off by introducing you to them one by one, and then I'm going to ask them why are they here? Nick King, or Nicholas King, is the founder of Data Kinetic, and he is become a very, very good friend. And not only that, he's actually come into my operating room, and he's followed me in clinics and actually seen patients. And Nick has got an extensive experience. He was one of the first 12 people working on Google Cloud. And he's worked at multiple big companies and worked in really cool things like Formula One and the oil and gas vertical for AI. And he speaks funny because he's a Kiwi. He's from New Zealand, and he's also a good friend. And so, Nick, why are you excited to be here, and why don't you just talk to me about you?
Yeah, well, first of all, thank you for having me, and it's wonderful to spend some time with everyone this Saturday morning. I think as we look at AI and robotic surgery, just how fast this space is coming, but also the opportunity to bring together so many different data sources that open up intraoperative and postoperative opportunities for making decisions or supporting decisions throughout the surgery, but also identifying factors afterwards. Even in a short amount of time of looking at this data, there isn't a hour spent we don't find an opportunity we can kind of put to the side and say, okay, we'll come back and explore that later. And I think that's been really exciting from the data side. I think the other piece is meeting many surgeons like yourself, Dr. Khalpey, and the folks on the call. There's a real science-based focus and applied focus on how to use AI. And I'll get a little bit into, AI by itself is nothing. It is an enabler for smart people, experts like yourselves, to make decisions to support that and continue to push forward, the scientific discovery of new protocols and be able to publish them and share them with your peers. So really exciting to see just the progress we've made in the last, 3 to 5 years. And I think, as I said, there's so much that we can take advantage of, but at the same time, the practitioners are at the center of this transformation. It's not going to be a nerd from Silicon Valley that makes a big difference here. It's going to be folks like yourselves. So really happy to be here this morning, and thanks for the time.
Well, I thought that it would be nice to get to know the speakers before they give their talk. So appreciate that. And the next speaker is Dr. Armin Argami, who has been at the Mayo Clinic for many years and trained overseas in Iran, but has done his residency at the Mayo Clinic. And he's basically, one of the really formidable thinkers in how to intersect AI, and he's in a beautiful system. I think Mayo Clinic platform is probably leading the pack in the world for talking about how can we critically use AI responsibly with their platform in the world in healthcare. And Armin is, I'm hoping, he's going to spearhead and tell us what works under the hood at Mayo's clinic platform, and what would you use it for? So Armin, welcome, and also thank you for being here, and very excited. By the way, just to preface everything, all the surgeons here are robotic surgeons of very good standing, and I've learned from Armin a hell of a lot as well. So Armin, why are you fired up to be here, and what do you want to tell everyone?
Thanks, Zain, for having me, and I'm so pleased to be among everybody else here. I'm probably the least experienced of all of you, and I learned from you a lot too. Well, what I thought this was important to me was, surgeons are usually not the ones attributed to, forward thinking and AI experts. So my goal was to, bring this to attention to all surgeons, specifically in the cardiothoracic, field. I've been running around and telling everybody in this field that, this is something coming. We need to get on the, bandwagon and advance and develop. Talking about the robotic, expertise that you guys have, I think that's the gateway of surgery and AI. I think we'll talk about it in everybody's talk. I'm pretty sure everybody will touch on that. But I think this is a unique opportunity that we have that can connect us with the AI and the robotic systems much faster than any other field in surgery. So that's what excites me.
Yeah, that's exciting. We're looking forward to that. Dr. Ramsey and I first met when we were at a conference, but he's trained at very well trained. He's a Canadian, and he's definitely a powerhouse in innovation in robotic cardiac surgery. And we have a lot of cool conversations in the back end, and he's done a lot of very provocative things. And not only that, he's very accomplished, and he's also a very humble man, and with a steady hand. And I think Danny's valvular work, I mean, he's multifaceted, but his valvular work is interesting, and he's going to talk about that today. But about how AI can bridge the gap in some of the barriers that surgeons feel. And I'm excited that Danny's here, and he's exceptionally busy as well. But Danny, what do you want to tell everybody, and what excites you about this topic?
Well, thank you for having me. Thank you for the invite. And I'm surrounded by a lot of people who've done a lot of work, much more than we have here. So I'm here also to learn at the same time. So thank you for the invite. I'm particularly excited because it's a time in cardiac surgery where we're forced to innovate as we did back in the 50s, 60s, and 70s, where cardiac surgery led innovation in medicine, not just in surgery. And I think AI is the logical next step. AI and robotics, I think, from my point of view, is the future of heart surgery, and not just in terms of improving patient care, improving what we do in minimally invasive aspects, but also democratizing care and getting this technology out into smaller centers, into rural centers. I think this is sort of going to be able to bridge that gap where we've been trying for years, but not unsuccessfully. And as everybody in this panel knows, these surgeries are concentrated in a few hands in a few centers. I think it's up to us to open this up to be able to train further out, to be able to get the same results regardless of volume by leveraging AI, leveraging our collective knowledge to train the programmers in terms of making the programmers into healthcare specialists and us into programmers, so we could be able to lead in the future. And I really do see this as the future for our specialty.
Thank you, Danny. Dr. T. Sloan Guy is the director of minimally invasive and robotic cardiac surgery at Georgia Heart Institute. And honestly, I've been following T. Sloan Guy for many years and on social media. And I met him at a robotic conference recently and a workshop with the Society of Thoracic Surgeons. And not only is he a pilot, he is a veteran. He's a trauma surgeon who served for us, but he just commands respect. And I've had so many cool conversations with him, and especially when he was showing me the automatic mode in Tesla, and when he wasn't driving with his hands, and I was like, this is really cool. And I thought, well, this would be really cool to bring in as a segue to automating robotic heart surgery. And we'll get there in terms of automation. But T. Sloan Guy is somebody who I adore in terms of his mind, and also he is just an accomplished legend and pioneer. And so I've always looked up to him, and I'm really excited that he's here to show us a smattering of what really is out there in the field in terms of robotics and what we can do with AI in robotics. So T. Sloan Guy, what makes you tick, and why are you excited about this?
Thanks, Zain, for having me. I'm absolutely thrilled to be part of this incredible group here to talk about AI and surgical robotics. I've had so many experiences in my life, and one of the most impactful was I lived in the Bay Area for 4 years in Mountain View, California, where right in the heart of Silicon Valley, where so many innovations, including surgical robotics, came out of. And it's really impacted the way I think about innovation in robotic surgery and what I call the digital world of surgery. So I think that right now, at this moment in time, we are starting a period of time of about 20 years of development of merging digital surgery and data with robotics, the physical world, and physically fixing patients. That at the end of that 20-year period, we are going to see some things that are almost unimaginable even at the current time, such as autonomous surgical robotic systems, various improvements in surgical robotic systems that allow for improved performance by surgeons and their teams, and remote telesurgery, which is already starting to become a real thing, even though it was actually the original start to robotic surgery, period. It was meant to be for telesurgery in outer space and on the battlefield. And unfortunately, the technology did not exist to make that happen, but it's actually happening now. So, I'm just happy to be on board, and recently returned from the Society of Robotic Surgery meeting, where I was completely overwhelmed in realizing that there is basically a tsunami of effort around the globe, development of robotic surgical systems, and it's very exciting.
Yeah, no, I'm really excited that you're here, and so looking forward to that. I know that Andrew Gums is in the background over there, but before I speak to Andrew, I want to introduce you to the last speaker, but not least. Jefferson Ben Taylor is a guy that I met at a geeky conference. Him and I had a really wacky conversation, and then we sat next to each other and spoke about healthcare. And he was the keynote speaker at that conference. But the most important thing about Ben is that he solves kind of the trickiest problems that SpaceX have, that Red Bull has. And he's a founder and a CEO of his new startup called FETCS. And he has worked in every tech space that you can think of. And not only that, he sold his really popular company, Zeph.ai, to DataRobot in 2020 and became the chief AI strategist at DataIQ, which is a French company, which is massive in Europe. But, what's really cool, and the reason why he's the last speaker is because I wanted to hear what he's going to say about self-evolving AI systems, which I think in particular robotics leans itself to, which is kind of what we've alluded to. And so that's kind of really, really important. And so Ben, I know you're probably at a lake in your shorts, and you were going to say you were busy with the family. So I'm really happy that you're here, and I'm so excited to hear what you have to say. But you always inspire me, and your genius is amazing. So tell me what's firing you up, and what are you going to tell the world today?
Yeah, thanks for having me here. And hopefully you don't ask me any hard questions, or my AI avatar won't be able to answer them. So the three things I'm excited to talk about is I want the audience to realize that AI is much more familiar than they realize. It should feel like a natural extension to everything they do. And then I also want to really lean into the limits of the human mind and why AI is necessary to augment us. So we've already talked on this call about scale, but I think it's also going deeper than that. It's a human's ability to innovate is greatly limited and that's why I'm excited by these newer systems. And then I think I really want to end with trying to convince the audience that we're actually moving much faster than they realize today. And that is good, because that means the future that has already been suggested and talked about on this call will be coming sooner. So the digital twin, being able to do surgeries and innovate without a human, can be really exciting. So yeah, thrilled to be here. Thank you for the invite, and stellar group. So I'm excited to participate.
Well, I wanted to just tell you what we're going to talk about, but today, in terms of the topics that are coming up, but I don't know if Andrew Gums, you can unmute yourself and talk.
As you can see, I'm traveling. I'm trying not to make too much noise. I'm sorry everybody, but I'm enjoying this wonderful webinar. So I'll chime in more when I'm not so noisy.
Thanks, Andrew. Andrew's just once again the editor-in-chief of the AI Surgery Journal, and a really good guy. So we're going to start off with Nick, who's going to talk to us about leveraging AI agents and how that would unify data in surgery. Then Armin's going to talk to us, about the pre-op, intra-op, and post-operative stories of AI in cardiac surgery. And Danny's going to talk about AI in valve robotic surgery. And then T-Sloan Guy is going to talk about the Big Bang and what's going to happen right now. And Jepson Taylor is going to talk us about how the rapid pace of AI and innovation in healthcare will be responsible and impactful, and how we can adopt it. So, and then we'll actually open up to the audience for audience participation with questions. But at the end of each session, we'll be talking after each speaker is finished. So I'm actually going to, this is my last slide. I am going to stop sharing my screen and give it off to Nick King.